Good evening, I'm Dennis Ward, and this is Face to Face. Our guest this week is Mary Ellen Turpel-Lafond. Mary Ellen is a former judge, a lawyer, and a longtime advocate for children and youth. She was BC's representative for children and youth for a decade. In June 2020, Mary Ellen was appointed to head up an investigation into racism in the BC healthcare system. Mary Ellen, thanks so much for being with us. As we just mentioned there, you've just released your report called In Plain Sight, addressing Indigenous-specific racism and discrimination in BC healthcare. The investigation was launched in part because of allegations that healthcare workers were playing Price is Right type of game to guess the blood alcohol levels of Indigenous patients. What did the investigation determine about that allegation?
Yeah, so what I found was that there isn't an organized game, but the name Price is Right. That's where there's prizes and it's operating all over. I did find episodes and places where there is guessing about blood alcohol level. But as I said at the release of the report, I think it probably would have been personally an easier finding if it was just simply a game that was happening in BC healthcare, which was away from patients, if you like, even though it would have been profiling and potentially racist. What I found, in fact, was despite some guessing happening here and there, at the direct point of care with Indigenous people, First Nations and Métis in British Columbia, I found hundreds of examples of direct personal racism and implicit bias and systemic racism.
The investigation heard from thousands of voices through surveys, submissions, and interviews. That's a tremendous response in just a few months during a pandemic. You write the results are disturbing. What were some of the things that stick out for you?
Yeah, I was fortunate enough with a small team, an Indigenous-led team, to engage with more than 9,000 people directly and investigate or review about 600 cases. I was given authority to look at all the data that was available. I was designated at the level of the minister to look at as well data to look at whether or not what I was seeing on the ground was systemic, like what happens when people go into hospital emergency rooms, et cetera, are Indigenous people being treated differently. So what I found was 84% of Indigenous people in First Nations, Métis, there are some Inuit as well, experienced racism in the BC healthcare system at the point of care. And for the most part, that was direct personal racism. And of the healthcare workers in BC, 1/3 of the non-Indigenous healthcare workers identified or provided information to me about an incident of racism that they'd observed at their point of care. And for the Indigenous healthcare workers, that could be Indigenous nurses, doctors, lab techs, food service workers, Indigenous people working in the healthcare system, 52% reported experiencing direct personal racism from their colleagues in the workplace. And that was something I spoke a fair bit about to the Minister of Health and to the health unions, the colleges and regulators, because if Indigenous people are not safe in their workplace and they're experiencing racism as the staff, and I'm finding Indigenous people at the point of care also experiencing racism, that's a deeper problem than I think was acknowledged. And especially for the Indigenous healthcare workers, I found that their stress, their employment has been adversely impacted because of the racism they've experienced. And I even found multiple cases of where the racism was career limiting, meaning someone should grow and develop in their role, in their job. They should be supervising a unit, for instance, or advancing. But the racism had actually limited their career chances and their opportunities. Really, that racism based on those personal characteristics of being a First Nations Métis person, being part of a different, from the mainstream in the hospital situation, for instance, culture, race, identity, and that the racism and discrimination was additionally compared to women. And so the level at which a lot of the racism is targeted at women is significant, and I document that in some detail in this report.
As the report indicates, and as we know, as the review was underway, events happened in other parts of the country that laid bare the racism in the healthcare sector, including the death of Joyce Echaquan. What does that say to you?
I do think about, if this was run in Manitoba, Saskatchewan, Quebec, would the results actually be different? Like, would they even be more severe? And I can't say for sure, but the one thing I can say that was very positive here was that the government of British Columbia and the health minister said very clearly, I want you to do a full look at this and bring it back, and we're open to it. And he certainly felt like he has an obligation to do that. And when he accepted the report at the release yesterday, he used words that no other health minister has ever used, which is, first of all, setting a tone with an apology and ensuring that that tone goes down through the system to the point of care, because he's not going to atone for this. It needs to be at the point of care. But also he used the words racism, systemic racism, prejudice, and he began to unpackage what this looks like, because I had to really talk about, like, what are the 8 key stereotypes that are operating in the healthcare system, and really take them down. And while I was doing this work, got a lot of negative feedback to say, well, the racism is because Indigenous people have it coming or they deserve it. And so just that backlash, it's important that we precisely studied it in BC, that we amplified the voices, and then we showed the patterns. And that was very important, because stereotypes lead to discrimination, and that impairs access to healthcare, and that drives health outcomes gaps. So I'm glad in BC, we have a lot of work to do, but at least the minister, unlike, say, Quebec or elsewhere, said he named it. He named what this behavior is and the beliefs that drive it and the need for the system to address it. So we have a lot of work to do, but that, I think, was quite positive from my viewpoint, and I think for many Indigenous people in BC.
Mary Ellen, a lot more to unpack with this report. We've just got to step aside for a quick break, and then we'll continue the conversation here on Face to Face. Welcome back to Face to Face. Our guest this week is Mary Ellen Turpel-Lafond, who's just released a report on racism in the BC health sector. And you heard from many healthcare workers, 70% of whom were not Indigenous. You also heard discrimination and racism in those responses. I believe something like 500 comments. Can you talk about that?
Yeah, I would say throughout the last 4 months doing the review, like, I used a survey tool that went out to 5,400 plus, so almost 5,500 healthcare workers in BC. Primarily non-Indigenous workers would have responded. But in addition to naming or identifying, like, an abusive interaction that they might have witnessed toward Indigenous people, then in the comment section, they actually made prejudicial and racist comments. And they were things like, I could read you one of them. Like, they said things like, all lives matter, stop being a victim, you get everything for free, it's your own fault if you don't get health care, we're very accommodating, it's their behavior that's the problem. So every one of these stereotypes that I found circulating, which were not just like unconscious bias, it was pretty conscious. Well, they identified a specific abusive interaction and described it, then they repeated prejudice to sort of explain it away, as though to say, but it's Indigenous people's fault. And a lot of it was kind of like what we used to hear about residential schools in the 1980s. And I remember this well, when it would be like, get over it, like, we're tired of hearing about the past, not understanding how the history of segregating Indigenous people in healthcare and just all of these abusive stereotypes that circulate. So Yeah, 531 specific comments that were very prejudicial and very disturbing. And I did have a chance to speak to the health colleges that regulate these health professions and to talk about that and begin to unpackage it. And again, I can only describe those as really difficult conversations where I'd be saying well, hold on a minute. Why are you blaming Indigenous people for the fact that they're not accessing health care? It's not the fault. It's the kind of health services you're providing and the type of stereotypes. And so hence in the report, I actually tell some stories of what I heard to be able to make it clearer, to illustrate it, because there's such an entrenched attitude of prejudice in many places, and it touches people across the lifespan.
Large numbers of Indigenous patients say that they've been discriminated against or stereotyped in a variety of ways. And like you're saying, people are willing to say this in an investigation into their profession. Now, what impact does all this have when it comes to, access to health care for Indigenous patients and the outcomes that they receive?
Well, it has massive impact, and I try to describe here, and again, trigger warning for your viewers and listeners, because this is really challenging, but I had to get right down to the detail. I describe how these primary stereotypes, like Indigenous people are drug seeking, they're drunk, they're less worthy, or for the women, a lot of very misogynistic beliefs, like Indigenous women are in sex work and they're very sexually available. So I describe how those specific stereotypes lead to discrimination at the point of care, like abusive interactions and so forth, and then how all of that then comes to poor access to care. It's not a welcoming environment. And many Indigenous people said to me, I'd rather just deal with my health issues on my own, even if it means my life's going to be shorter, I don't get treatment for cancer, or I don't get help for the stroke, because I'd rather do that than have to face this. And so it affects access, poor attachment to health services, and really deep mistrust. And then that in turn affects outcomes like life expectancy gaps, higher rates of chronic disease because you're not getting support. And I looked at everything from cancer care, organ transplant, emergency rooms. I really tried to shine a light across the board. And for instance, in Vancouver, we have one of the premier women's hospitals in the world. And people are very proud of their hospital. But I found that Indigenous women leave against medical advice at a rate of 11 times more than any other patients in that hospital. And they reported that these prejudices operate at the point of care. And, most people say, oh, it's a rural, remote problem. Well, actually, the report, when I actually looked at the cases I had and the information about things like who leaves emergency rooms, what is the interaction there? What's the continuum of care? Who gets into organ transplant? Who is getting cancer care? As we start to look at this, we see in every part of the healthcare system, stereotypes, discrimination, and lack of access. And that shows of Indigenous people in British Columbia, and especially for First Nations. First Nations have more severely unequal outcomes than even Métis, who are struggling as well with these same issues. And it was interesting because many of these places claim they're places of excellence, right? Mm-hmm. We're research places. We would never do this. We're not like that. But at the point of care, even these research and teaching hospitals are in fact fully engaged in many of these very same stereotypes leading to poor access.
These reports are often met with fanfare, and First Nations leaders have called for all the recommendations to be fully implemented, but more often than not, we find that these reports receive little action. Is that a concern for you?
Of course it is, and I think I tried to develop this report and have constant conversations with the health and the leads of all the health authorities, all of the regulatory colleges, the unions. So I had a constant conversation there. Our Indigenous team had a constant conversation, and we want to be able to craft recommendations that have immediate impact. So You'll note that some of my recommendations, and what the Minister of Health said is if you hold privileges at a hospital, then that privilege needs to be redefined to say it's only going to be held as provided you are going to be giving care in a way that is not racist. And really, we need to develop stronger anti-racism tools and ensure they're being applied so that this concept of privileges, or even the concept of what is quality, like we have a complaints process if you don't have quality care. But quality is not defined as meaning the patient is entitled to service free of all forms of discrimination, especially for Indigenous peoples. So there are a number of tools and points where significant change can happen and accountability can begin. And those tools have simply not been used. And so I've pointed those out. The system is saying, okay, we're going to begin to bring them into play. And I think that's the key piece, is accountability won't happen until it's very clear that the privileges you have in the healthcare system depend on you being able to act and engage in a way that is anti-racist toward Indigenous people. And anti-racism isn't just like, oh, I don't see color. You know, anti-racism is really about the practice of identifying and challenging. And now that I've named, the top 8 stereotypes, if you like, I expect those healthcare providers to actually engage and begin to address that if they have implicit, explicit bias. So there's some specific immediate work to be done. And I'm sure it's a challenge because the healthcare system has got a lot of partners in it. But I have certainly heard throughout this process a commitment. The other thing I would say, Dennis, is that in British Columbia, we have a requirement because we have implemented the UN Declaration on the Rights of Indigenous People. There's been a law in place for a year. So there is a section 24 that says Indigenous people have a right to access healthcare without discrimination. That's for Indigenous people, Indigenous people's rights. And so in my view, I think a lot of these policies and standards need to be reinterpreted to be really clear to people. You realize this means that Indigenous people have a right to safe care without discrimination. And many of the healthcare professionals I engaged with, that was really the first time they'd really seen that. So things are shifting, but for sure, it'll be up to a lot of people about whether or not they truly make these changes.
Mary Ellen, I also want to talk about the child welfare system, but we just have to step aside for another quick break, and then we'll continue the conversation here on Face to Face. Welcome back to Face to Face. Our guest this week is Mary Ellen Turpel-Lafond. Mary Ellen, I do want to move to the child welfare system, but just to quickly go back to your report on healthcare, and your report says that the government should look at doing similar reviews into Indigenous specific racism and other public sectors. Can you just touch on that briefly?
Right. Well, I did get a number of complaints that were from, for instance, the K-12 system, where kids are not getting medical services there and often experiencing racism. And the justice system, where you have ambulance and police responding and getting a justice response, namely someone is detained instead of getting health services. And then, of course, child welfare. Families in hospitals frequently get targeted to be reported to Child and Family Services when they're there for their own health issues. So that was a concern to me as well. So without doubt, these racist stereotypes no doubt are circulating in other systems. The healthcare system is not just an outlier. So we do need to be very mindful of that, and we need to really continue this work.
As we mentioned, you are a longtime children's advocate. Work closely on Bill C-92, the federal government's legislation with the goal of allowing Indigenous communities to take over jurisdiction of Child and Family Services. The federal government has now announced $542 million to help move this forward. What are your thoughts on there finally being funding to back up some of this legislation?
Well, I think it's overdue. I think, in January 1, 2021, it'll be 1 year since that new legislation came into effect. And for 9 months of this year, we've been in a pandemic. The work has continued. I just know from my own home community of Muskeg Lake, there's a lot of work happening to take control back, and this new legislation has opened doors. But there will be First Nations laws coming into effect. This is a big job to change the child welfare system, and for sure the provinces are not necessarily fully excited to be doing it. There's work to be done. I also really am worried about how families have been impacted by the pandemic, like not having services at school. And because a lot of visiting with kids in care was shut down and courts were shut down. So I know just for myself, some of the reunification work I was doing to get kids out of stranger foster care back into care with their grandparents, everything stopped. And so this has been a really hard year. And I'm very concerned that the progress could be delayed. But I'm glad some more money is coming. But there are fundamental changes, and Indigenous children and First Nations children need to be raised connected to their families and communities, language and culture, and that we need to get all of those kids out of stranger foster care. And I know in British Columbia we have the lowest number ever, but I'm worried about other provinces because we don't really have good numbers and really serious. So the legislation is slow going. And as I say, the pandemic is something that I'm very concerned about, how it's broken up families and sometimes grandparents raising grandchildren. Like now they're sick. Grandparents have passed away and they were providing the stability and the risk of COVID to those caregivers in our communities. You know, it's a tragedy that I'm watching, but also knowing get more support to families. And it also tells me why we should have done this work years ago, because it's so hard to do it now. But I hope the federal and provincial governments will really stand up and support us, because it's been hard to push this rock up a hill on our own for a long time. And shout out to all of the people listening who care for children every day and stand up for children every day, and just keep doing so.
Mary Ellen, super short on time here. So, but 1 year ago in a speech to the AFN, you said it would take 5 to 7 years for the mainstream child welfare system to fully adjust to a big change like this. Do you still think it's going to take that long with this new legislation and funding before we see the lives of Indigenous children improve?
I think it is, and as I say, I think the pandemic has been a setback. And how I view that is, like, I would like to see all those kids out of stranger foster care, stop the constant removals, get them out of care, get them back connected to families and families supporting them, and doing that restorative work that's needed. And that should happen in every province. There should be a plan with targets and work and teams. And unfortunately, with the pandemic, I'm not seeing that. I'm seeing people basically just shutting down. So changing these systems is a big thing. I mean, people have had so much power in that child welfare system to knock on the door and remove a child and make very destabilizing allegations about people that are really mired in these attitudes about whether or not they're capable of raising their children, which is just utter nonsense.
Mary Ellen, we'll have to leave it there, but appreciate you doing the show for us and your recent report and all your work over the years. Thanks for being with us here this week.
Thank you for having me.
And that is all the time we have for this week. You can catch up on any episodes you may have missed by visiting our website, aptnnews.ca. All of our shows are also available as podcasts. You can find those at aptnnews.ca/face-to-face podcast. I'm Dennis Ward. Thanks for tuning in. We'll see you back here next week.